Hello everyone, I'm Maria. Today we are going to explore a fascinating case study by Savage and Silverman on button phobia. Have you ever heard of someone being afraid of buttons? Today we will learn about this unique phobia and how it was treated. Before we dive into the specific study, let's talk a little about phobias. Phobias are intense, irrational fears of specific objects or situations. They can significantly impact a person's daily life. For instance, some people are terrified of spiders, heights, or flying. Phobias can develop from various experiences, often stemming from a traumatic event. Some psychologists believe that abnormal behaviors such as phobias can be both learned and unlearned in the same way as any other type of behavior. Classical conditioning is a form of learning in which an unconditioned response becomes linked to a previously neutral stimulus to create a learned association. It was investigated by Ivan Pavlov, who observed dogs salivating in a laboratory as part of a totally different experiment. Salivation is an unconditioned response, that is, uncontrolled response to being presented with food. Unconditioned stimulus, that's natural response. The dogs came to anticipate the food when they saw researchers in the lab before feeding times. Pavlov presented the food alongside a range of neutral stimuli, such as bells, which created a learned association. Over the course of several trials, when the dogs heard the bell, conditioned stimulus, they began to salivate, conditioned response. Phobias may be caused by evaluative learning. This is the kind of classical conditioning in which the individual forms an association between previously neutral stimuli and a negative emotion, but this is a negative evaluation. For example, disgust rather than fear. This suggests that disgust as well as fear may be an appropriate target emotion for the treatment of phobias, as well as the primary emotion of fear. When a person or animal performs a new behavior, this can become associated with a consequence. For example, receiving a sticker as a reward for allowing a dentist to perform a checkup makes it more likely a child might be happy to return for future checkups. In other words, rewards reinforce behavior and makes the behavior more likely to occur. Operant conditioning can also be used as an explanation for how people acquire phobias. When people avoid the object of their phobia, this can reinforce future avoidance behaviors because their anxiety is reduced when they don't have to encounter the things they are afraid of. This reinforces or helps to maintain phobias once they have been learned. Psychologists can use the reinforcement principle of operant conditioning to treat phobias as well. Praising or giving other rewards for remaining calm when approaching a phobic stimulus can reinforce more positive behaviors towards such stimuli. Such treatment might mean that the person can better tolerate the phobic stimulus. Let's look at the aims of the study. The purpose of the study was to examine the role of classical conditioning in relation to fear and avoidance of a particular stimulus. There are two main aims: to investigate the cause of a button phobia in a child, to attempt to treat a child's phobia of buttons while targeting both disgust and fear responses. What's phobia? The irrational, persistent fear of an object or event, which poses little real danger but creates anxiety and avoidance in the sufferer. This was a clinical case study, as it involved just one participant whose life history and treatment was studied in depth. Data was collected using self-report measures. Both the boy and his mother were interviewed by the researchers about the onset of his phobia and his subsequent behavior. The results of the treatment were measured using a 9-point scale of disgust, known as the feelings thermometer. In this study, the participant was a 9-year-old Hispanic American boy. Along with his mother, he had sought support from the Child Anxiety and Phobia program at Florida International University, Miami. He met the criteria for having a specific phobia of buttons and had been experiencing symptoms for around 4 years prior to the start of the study. The boy and his mother both provided informed consent to participate in the study. Later, the mother provided written consent for the details of the study to be published. For the researchers, it was necessary to understand the boy's specific feelings towards buttons prior to starting treatment. Through discussion with the participant, they created a hierarchy of feared stimuli, with each item on the list provoking increasing fear. The most difficult items for the child were small, clear plastic buttons. These were rated at each on the 9-point feelings thermometer. Handling these or touching someone wearing them was the most unpleasant task for the boy. The boy was treated with 2 interventions, one after the other. The first was contingency management, a form of positive reinforcement therapy. This was a behavior-focused approach, which meant the boy was rewarded for showing less fear and for actually handling the buttons. The positive reinforcement was given to the boy by his mother only after he had completed a gradual exposure to buttons. These treatment sessions lasted between 20 and 30 minutes. The second form of the therapy, and the main focus of the study, was known as imagery exposure. Interviews with the boy had revealed that he found buttons touching his body disgusting, and he also believed that buttons smelled unpleasant. These ideas formed the basis for disgust imagery exercise. Unlike in vivo exposure, where the individual actually physically handles or is exposed to fearful stimuli, imagery exposure therapy uses the visualization techniques. Disgust-related imagery exposures were incorporated with cognitive self-control strategies. The boy was asked to imagine buttons falling on him and to consider how they looked, felt, and smelled. He was also asked to talk about how these imagery exposures made him feel. The exposures processed from images of larger to smaller buttons, in line with the boy's fear hierarchy. The outcome of the positive reinforcement therapy was a successful completion of all the exposure tasks listed in the hierarchy of fear. The boy was also observed approaching the buttons more positively. One example of this was that he started handling larger numbers of buttons during later sessions. However, his subjective ratings of distress increased significantly between sessions 2 and 3 and continued to rise. By session 4, a number of items on the hierarchy, such as hugging his mother while wearing buttons, had increased in dislike from the original scores. So, despite his behavior towards the fearful stimuli improving, his feelings of disgust, fear, and anxiety actually increased as a result of the positive reinforcement therapy. This finding is consistent with evaluative learning. Despite apparent behavioral change, evaluative reactions like disgust remain unchanged or even increased. Immediate exposure therapy appeared to be successful in reducing the boy's rating of distress. One example of this is shown in Figure 4.6, relating to imagery of hundreds of buttons falling all over his body. Prior to imagery therapy, the boy rated this experience the most fearful and disgusting, score of 8 on the feelings thermometer. This reduced to 5 midway through the exposure, and just 3 after the exposure was complete. Following his treatment, 6 months and 12 months follow-ups were conducted. At these assessment sessions, the boy reported feeling minimal distress about buttons. He also no longer met the diagnostic criteria for specific phobia of buttons. His feelings towards buttons no longer affected his normal functioning. He was also able to wear small, clear plastic buttons on his school uniform on a daily basis. The researchers concluded that the positive reinforcement therapy was successful in changing observable behavior, and the immediate exposure therapy was successful in reducing feelings of fear and disgust. In particular, they argue that emotions and cognitions relating to disgust are important when learning new response to phobic stimuli. Imagery exposure can have a long-term effect on reducing the distress associated with specific phobias as it tackles negative evaluations. Let's look at the evaluations. Strengths. Qualitative and quantitative data were both acquired in this study. This case study focused on one person only. Detailed data was collected. The study was conducted in a therapeutic setting and hence had ecological validity. Weaknesses. The study lacks Monday realism. The case study used only one participant, hence it has a low generalizability. The ratings are subjective, and this lowers reliability. Issues and debates. Application to everyday life. For treating other phobias, nature versus nurture. The process of acquiring the phobia relates to nurture. In terms of fear, it's a natural and universal emotion that everyone experiences at some point in your lives. It can be a powerful force, influencing our decisions and actions. However, as we've seen in this study, fear can also be managed and overcome with the right approach. Think about a fear you've faced in your own life. Did you choose to forget everything and run? Or did you find a way to face it and rise? Do not be afraid of fear. It sharpens you, it challenges you, makes you stronger. When you run away from fear, you also run away from the opportunity to be your best possible self. Thank you for your watching. See you next video.